Thank you for your invitation for this meeting. I will tell you about PNG 292 in Amsterdam, the Netherlands. PNG 292 is a partnership between HVO Querido, that's an NGO, and the Public Healthcare, the GGD, and that's a GO, financed by the municipality of Amsterdam. The goal of PNG 292 is to improve the emancipation and self-reliance of sex workers, whatever their sex workplace or residence status in the Netherlands is. PNG 292 tries to reach this goal by the improvement of the physical health of sex workers, strengthening their mental and social health, the improvement of their social and legal position, asking attention for forms of violence and sexual exploitation and acting against them, together with other organizations. Our vision is best described as based on two core values that are the starting point of our work in every respect: freedom to choose an occupation and physical integrity and resilience. I will tell you some history. In October 2000, prostitution was legalized in the Netherlands. In April 2008, PNG 292 was opened right in the center of Amsterdam. Apart from the medical care that the health authority provided for, a center for sex workers was needed, where they could get information on rights and duties, and at the same time help for mental and social matters, as well as a special shelter for victims of human trafficking. For that, we opened the Amsterdam Human Trafficking Center in Amsterdam at ACM. In 2009, there was the introduction of the project 1012. 1012 is a zip code of the red light district in Amsterdam. The goal of this project is to reduce criminality, trigger economic upgrade. In 2012, there was an introduction of a 5-year prostitution program. The city's prostitution policy was designed to involve the entire sex industry in strengthening the position of Amsterdam sex workers and combating abuses in both licensed and unlicensed branches. Important changes, businesses active in the sex industry were required to apply for a new license. Additional license requirements include intake and supervision. Operators who have concern about sex workers' safety or independence can contact the City of Amsterdam's advisory team for help. The sex workers' age was increased to 21 years. Sex workers need to speak at one language like Dutch, English, Spanish, or German. They need a Dutch or an EU document, and they need registration at the Chamber of Commerce. Consequently, about 23% of the windows have been closed since then. That's 112 windows out of the 470 windows they were. Before this program, we saw a lot of vulnerable sex workers, but after this program, we see more stronger sex workers in the licensed branch. But where did the other sex workers go? The law regulation sex work, the WRS, has not been passed yet. This law obliges sex workers to register themselves as sex worker. The minimum age will be raised to 21 years. Sex workers need to do an interview with an officer. The officer will decide if the sex worker is self-reliant enough to do sex work. And most sex workers do not want to register themselves because of their privacy. And we think that access to care will get worse. PNG 292 is easy accessible, located in the center of Amsterdam. We have flexible opening hours, consultation hours of healthcare, social assistance. All services are free of charge. The sex workers can come with their work name. We have comprehensive sexual health care. For example, illegal use of hormones by trans sex workers. We do STI screening. In 2019, with 2,222 screenings, We offer free hepatitis A and B vaccination. We offer PEP care and we offer PrEP care. But if the mountain won't come to Mohammed, then Mohammed must go to the mountain. So we also do outreach work. Outreach work, we go to the windows, we go to the clubs to offer all kinds of services like STI test or social assistance. In 2012, we started with online outreach. An increase of sex workers are working from home ever since the Municipality Start Project 2012 in the 5 years program. So we search on internet for new profiles. In 2019, we sent 1,007 text messages to female sex workers, 212 text messages to trans sex workers, and 387 emails to male sex workers. The following day, we tried to call them and to inform them about PNG 292 and what we all offer. Most of the time, we use a peer educator who speaks Spanish. This is also an ex-sex worker. We have special interventions to reach out to trans sex workers. At PNG, we started to work with a trans peer educator. She has a special consultation hour. We opened a lounge special for sex workers where they can meet other trans or other sex workers, or they can drink just a cup of coffee or tea and just relax. We started a sounding board group for trans sex workers. Every month, we organize a meeting with all kinds of subjects. In 2019, we started with PrEP care for trans sex workers. During the COVID-19 lockdown, sex workers stopped or went advertising on internet, the unlicensed sector. Therefore, we are making new intervention to reach the trans sex worker in the unlicensed sector. We are making a web scraper that will scrape the website for new sex workers' advertisements. Profile names and contact information are temporarily stored in a database. And with this data, we can inform sex workers on the internet about the offer of PNG 292. Now we do it manually. In this way, we hope to approach more new profiles and to make an effort. In the future, hopefully next year, we will opening a trans clinic. This clinic is for all trans people of color who do not have access to regular hormone treatment. We offer in this new clinic not only hormone treatment, but also STI testing and PEP and PrEP care.
Thank you for having me today. I will hope that you like my presentation. In 2018, Trans United Europe was founded to advocate and improve the position of trans people of color in the Netherlands and in Europe. One of our main aims is to inform policymakers and politicians about sex work, HIV, and the precarity amongst trans people of color living in the Netherlands. In 2018, we were asked by the Municipality of Amsterdam to be part of a research project on the position and living conditions of trans people of color in Amsterdam. Together with two anthropologists of color, we started out doing the research. The research was a peer-to-peer qualitative research conducted by Trans United Europe among 40 trans people of color in Amsterdam, with a particular focus on the most vulnerable groups: refugees, sex workers, and people with HIV. Outcomes of the research led to a specific policy of the Municipality of Amsterdam regarding the living conditions of trans people of color. Also, in 2019, the trans safe space in the red light district of Amsterdam opened. The trans safe space is for and by trans people of color and is a space for day shelter, community building, social projects, clothing projects, sports, and once a month the trans health clinic for hormones. The offering includes consultation hours with police, lawyers, confidential counselors, and sexual health and HIV services. The location in the red light district in Amsterdam was specifically chosen because the red light district is a low threshold area for trans sex workers, which is familiar, has a good security, and is welcoming of trans people. Trans United Europe focuses on several key projects. One of them is community building. We do empowerment meetings, trainings of policymakers, police, and service providers. We are part of the Trans Pride Commission of the Pride of Amsterdam. We offer swimming classes specifically for trans people and self-defense courses, also specifically aimed at trans people. Secondly, we do capacity building. We speak about our causes, BIPOC trans perspective, access to healthcare, racism, and sex work with stakeholders like ILGA Europe, Trans Allies for Sex Work, HIV and Trans People, and are part of conferences such as AIDS 2018, ILGA World, and ILGA Europe conferences. Thirdly, during COVID-19, together with other sex worker organizations in the Netherlands, we set up the Dutch Emergency Fund for sex workers. Through donations, we have raised several thousand euros, which we could use to support the most vulnerable sex workers affected by the COVID-19 lockdown in the Netherlands. This was the Dutch Emergency Fund for sex workers. Since October 2020, Trans United has taken over the Dutch Emergency Fund, and we are currently looking to keep raising money so that we can still offer donations to the most vulnerable sex workers in the Netherlands. 4, we receive funding for sex work and COVID response. We are having funding to have a health and labor conference for BIPOC trans people to be held in 2021. And we are part of AIDS Fund Sex Works Coalition. Also, we do intersectional policy work with ICRSE and NSWP as members and as board members. And we work with several stakeholders such as the healthcare providers and social workers to include our work in their specific projects. After a visit to the Key Clinic, which is an NH and trans community health project in London, the idea of the Trans Health Clinic by Trans United was born. And this project was started in 2018 in the red light districts in Amsterdam. This is an accessible clinic for trans people who don't have easy access to regular health care that is available in the Netherlands. The back office, the intake, admin, and a multi-language nursing is led by trans BIPOC, while the doctor team is a mix of trans and cis physicians. The focus is primarily on hormones, but we seek to enlarge our offerings in the future. During the intake, we saw a large amount of risky behavior of the clients. This includes chemsex use, street-based work, homelessness, patients with HIV or STDs. That is one of the reasons why we want to incorporate sexual health and social services into the offerings of the trans clinic. The clinic is for all trans people, not exclusively for sex workers. A part of our patient base cannot access PrEP care through sexual health care because they are not legal. In the second stage of the Trans Health Clinic, we are looking to work together with P&G to enlarge the offerings that we have in the health clinic. We like to offer more P2P services, starting with specialists and social workers, police, and human trafficking. We want to do HIV and STD testing on a peer-to-peer basis at safe space or by field work. We want to collaborate with HIV healthcare providers so we can offer PEP and PrEP service to the most vulnerable groups. The main aim for this is to enlarge the PrEP use among trans people. We also have a seat at the table at the H team, which is the HIV team in Amsterdam, where we work together with a lot of other organizations to get 0 new HIV infections in the Netherlands. We hope to achieve this before 2030.
We hope you liked our presentations, and we are now available to answer all your questions. So feel free to ask us anything you want.